Hi there YouTube fam, and in this one I'm going to be answering the question what causes clicking in the back of head. As well as that, we're going to talk a little bit about the back of the head, the medical term, and also muscle pain in the back of the head. And we're going to get going right now. My name is Dr. Craig Hindson, and in this channel what we look at are tips and exercises to reduce neck pain and migraines and correct upper and lower spine nerve issues. So if you like that sort of material, it's of use or value to you, then just go down below, hit the subscribe button, hit the like, or if you don't like it, hit the dislike. But down in the comments, tell us why you like it or why you don't like it. And that pumps the algorithm and allows you to help other people improve their health and well-being. And let's get straight into it. Now, there's three questions I'm going to answer here. The first is someone asked me, the back of the head, medical term, what is it? The reason I ask is they've been having a clicking in the back of the head, and also they've been suffering with muscle pain in the back of the head. So let's start with the back of the head medical term. Okay, now I borrowed Harvey's head. I have my skeleton head here. The reason I got my skeleton head, I don't know if you realize it, but the skeleton is made of a number of bones, and the bones are knitted together, almost, in fact, very much like an intricate jigsaw with what's called sutures. I don't know if you can see here, but we've got a little tiny, fine, zigzaggy suture. It comes all the way around, comes down there. So this part of the skull, this is called the occiput. Okay, so this is called the occiput. The occiput is the medical term for the back of the head. The occiput is very central. Now, why is that relevant? All the muscles from the top of the spine come up and attach to the occiput. There are fine muscles that go from the back of the head to the very top bone. I talk all the time about the top bone of the spine. Unlike the majority of the vertebrae in the spine, which are block-like, okay? They're rectangular in shape as you look at them from the side. This is from the side. And then they kind of have a fin coming out the back. That's called a spinous. Okay, and this spinous has muscles attached to it. That's so those segments can be rotated, okay, as I move, and also they go up, or the down is the pulling from the front. But there are muscles attached to the back that pull us back and up, okay? And there are diagonal ones that pull us side to side. Okay, so this is a regular bone of the spine. There are 24 bones of the spine. The majority of them are like this, but there are some that are atypical. And the first and second bone in particular, the first bone is atlas. Now, the skull sits on top of Atlas, like in the old mythology, Atlas was holding up the skull. Well, that happens here. Now, there are two little pins here, which we don't have in reality. This is just to hold my model together. But you can see that the pins come out of a surface. That surface is called the condyle. Okay, basically it's a sliding surface. The skull at the bottom, you can see in this case, it's actually got a couple of little holes in. You can see where the little pins go. These are the condyles on the occiput. Okay. Now, you'll perhaps notice that they're shaped upwards, that they're curved like this. And that's because that particular joint allows for sliding, extension, and flexion. Okay? So as you look up and look down, a lot of that motion is coming from those two bones. In fact, not just a lot of it, the vast majority of it. The occiput moves on top of Atlas, and Atlas has a similar arrangement with Atlas. So there is an element of motion there, but the vast majority of the motion, a little bit like when you go to the fairground, when you go to Disney, you go on the pirate ship and it swings backwards and forwards. That is the motion that you get with your occiput, the back of the skull, and Atlas. That's the medical term for the back of the head we talked about. Now, the clicking in the back of the head, if there's been some sort of trauma, could have actually been as far back as birth. If there's been pulling when baby comes out, or in some cases, even when you have the most natural birth in the world, when baby comes out, there can still be imbalance. Okay, that imbalance can lead to an imbalance in the muscles at the back of the head. there are 8 muscles at the back of the head, tiny muscles which are small but have a massive influence on a lot of things. The top ones, the top brown ones, rectus capitis posterior minor muscles, they attach directly to this bone. So if they're in spasm, or one side's in spasm, then that's going to cause this this moving surface to be jacked up on one side. So when we're moving our head now, there's possibly audible sounds. Now the audible sound, the clicking, is most likely nitrogen gas in the joints, in the synovial joints. The synovial just means it's filled with fluid. So it's a joint that's filled with fluid, and as it's stretched open, the fluid expands, but it gets to a point where it can no longer expand. There's a vacuum forms, and as the vacuum collapses, that's thought to be the clicking sound that we can hear. More likely there's been an imbalance. Could be as early as birth, as I mentioned, but then throughout life, trips and falls. Whiplash is another example. Here in Canada, I've had a few people that have had hockey sticks around the back of the neck, hitting in this kind of area here. That's very common. Falling off of bicycles. There are thousands of things that can give you this kind of injury. Also, tradespeople, people that are painting the ceiling a lot, perhaps they're mudders, perhaps they're plasterers, they're looking up a lot in that position for prolonged periods of time. Okay, if there's an imbalance in those 8 tiny muscles at the back, it can actually radically change what's happening there. Also, those muscles are controlled by nerves that come out of the spine. Okay, so if the top of the spine is out of balance, it could distort the signals going to those muscles. Okay, again, if the motion starts to be reduced, then the signal going from the motor receptors in the muscles, which feed back to the brain, now the brain thinks there's an imbalance, and it actually adapts how those muscles are going to contract. So again, that leads to further imbalance. My job as a chiropractor, as you guys know, is let's work, especially if we've got muscle pain, back of the head. Lack of concentration is another example. Poor sleep. In fact, if you've seen the nerve map that we have, you'll see that that top bone is actually the master control switch of all the bones in the spine. Okay, that is the master control switch. The reason being is the spinal cord, and I want to show you this, the spinal cord, as it exits the C1, the atlas bone, actually wraps around the brain stem. Okay, the brain floats in fluid, and at different times it actually dips down, and the brain stem comes down into atlas. So if atlas and those muscles are out of balance, there's a school of thought that says there's going to be torsion on the nerve system, which in turn is going to start to distort signals. I personally find in a lot of cases there's an imbalance here, very common that people are getting migraines. Now, what can you do for it? Now, obviously, the bottom line, at the bottom level of the strategy that we use here is adjustments in rhythm. So in other words, we want to adjust the spine, take pressure off the nerve system, give some relief at that top level for sure. So adjustments in rhythm. That is the secret sauce of what we do in this office. The second thing is spinal hygiene exercises. So once we unlock the spine, you have to be responsible to actually get the motions in. We've got a tummy time one, we've got a forward head carriage reducer, I do some hanging for lower down in the spine. So we do a lot of good work, spinal hygiene exercises, specifically to improve communication between the brain and the nerves, the muscles in the neck. And then the third level, the 4 pillars of health. And you'll see on our YouTube channels, we've got 2 of them. One's all about the 4 pillars of health. It's called the Loving Life Pyramid. Just check down below, there'll be some links. Hi there guys, so that's a pretty well-rounded explanation of clicking in the back of the head. And I've got something coming up for you right now. It's very special for those of you that have been suffering with migraines or headaches, or know people with migraines or headaches. Just check this out right here. Okay, just check this coming out now. See you on the next one.